So here we go. It is just a few days away until the Medicare annual election period begins. And choosing a Medicare Advantage plan is not easy because there are a lot of different plans per state, per location. Each plan is approved annually. We know those details now. So if you're an existing Medicare Advantage plan policy owner, then you've already received something called annual notice of change. That's already come into the mail from you, and then you look through it and your eyes gloss over. And the reality is that there's no comparison, right? There's no comparing Ford F-150 to, a Ram truck compared to GMC. That's not allowed, right? That's not allowed by the federal government, the CMS, which governs Medicare, the Centers for Medicare and Medicaid Services. They just won't allow it, right? And you can understand why. They don't want to be seen as endorsing a particular plan because the federal government has approved each of these plans. So just like the podcast and all the other YouTube videos here on the Maximize Your Medicare YouTube channel, today is not financial advice. Let repeat after me. Today is not financial advice. Do I have the ability to give financial advice? Yes, I'm licensed, regulated to do so. Am I going to be appointed with many of these plans in many of the locations where you're watching this? Of course, that is the way that we work. That's how brokers work. GH2 Benefits, my firm, is, of course, appointed with the widest variety of plans so that we can be representing our clients. We represent the client, not the company. Let's go through an example. It's not going to be that simple. I'm just going to tell you in advance. I'm going to show you just how complicated it can be. So this is Medicare.gov. Medicare.gov. This is the web page, and you can go to it and you can find out what you're doing here. I say you have an original Medicare. We don't know how we get our medications, and yes, I want to add medications. So what I've done is I have already entered Chicago, Illinois zip code 60616. So now we go to look for answers. And basically what happens here is you get the chance to enter drugs. So I'm going to enter some medications here. And let's start here with ProAir. Right, this is a inhaler for those persons with respiratory problems. You can see it here. So I've added it. And what will end up happening is up will come the screen, and there it is. Okay. Nothing too hard. Fairly. Let's add another one, simvastatin. Very common medication. Very. You can find it amongst the most generic. I did so intentionally. This person also, let's just call levothyroxine sodium. There it is. So this is the generic version of Synthroid for those of you who have hypothyroidism. Again, not difficult. Now finally, let's just use Novolog. So for those of you who are diabetic, type 1, this is insulin. Most persons may know someone. If they are not diabetic, you know that we have a diabetes epidemic here in the United States. So here we go. Let's see if we can finally get some cooperation from the mouse pad. There it is. Let's see. Not really the ones that we want. Let's try Humalog. There we go. Quick pen. So you can see that these are 4 medications, fairly well known by many people who are Medicare eligible, right? Now you hit my drug list is complete, and what we're going to do now is we're going to select And you can see. So in this area, we have a number of places. Let's just use, and I'm not endorsing or recommending any particular pharmacy. All I'm just doing is showing you examples. Okay, so let's widen the range here to 1.5 miles. Of course, big town, Chicago, lots of places to buy prescriptions. Let's use this one here, well known to many. And you can see what you are able to do is you're able to choose two. And I always recommend, I will make the recommendation to actually use two, because what we're going to find is we're going to find huge variances in the answers here. So now we're going to continue to plan results. So now we've selected our pharmacies, and now you can see it, how complicated it's going to be. There are 27 standalone prescription drug plans in this zip code. There are going to be 32 Medicare Advantage plans that include prescriptions. There are going to be 5 Medicare plans, Medicare Advantage only, without prescriptions included. So pretty complicated, as you can see. So let's just choose this one here. This is our focus, Medicare Advantage prescription drug plans, because the reality is most persons don't choose these unless, for example, they have very good drug coverage from another source. And of course, the primary one in the United States being the VA. So VA, for many people who may know, if you are covered by VA prescription drug benefits, it is frequently as good as, if not superior to, the pricing available in Medicare plans. And that's because the negotiation process between the VA and the pharmaceuticals is different than it is under Medicare and the VA. So let's continue. Now, here we go. We have 32 plans, and what you do is you have all of the plans listed here. All of them. And you can see with those medications, you can see over here on the left a thought about how much the medications are using the different plans. You can see whether or not all your medications are covered by your Medicare Advantage plan. You can see its premium. You can see the deductibles. So you can see this particular plan, this particular carrier has no premium. And you can see its prescription cost, your anticipated estimated annual drug cost, manageable here. Less than $40 a month. So now you can see that it becomes more complicated. Why? It's HMO. So you're going to have to know about the network on the HMO. You're going to need to know whether or not your healthcare providers accept this HMO. You're going to have to deal with the idea of referrals, whether or not your plan requires referrals from your primary care physician in order to see a specialist. So you can see it's easy to just simply say, okay, well, I'm going to focus here and on the low premium, low drug deductible, low health plan deductible. Those are undeniably the case here. Nevertheless, what you have to deal with is now an HMO. So the question then becomes, and one I'm not going to decide for you over a recorded YouTube video, obviously not. This is the time that you need to have an expert, because you need to have some help here to check out whether or not your carriers, your healthcare providers, whether your hospitals, your specialist, podiatrist, eye doctor, person who's type 1 diabetic, hematologist for some, or I guess somebody who checks on your thyroid condition, whether or not those providers are going to be able to be the ones that you depend on, or whether or not you're going to be able to locate primary care physicians and specialists that accept this combination. You can see it becomes complicated. There's still a lot of plans here. The next plan. So you can see that these plans here, HMO POS, still zero, still zero. HMO POS means you can use certain out-of-network providers. You can see it comes at a cost. Instead of, let's see, how much was it? $420, $480 in a year. You can see now it is $1,200. So now $700 difference. Yes, but you can go to a wider network of providers. Maybe that's your provider. Let's continue on. Let's say you travel and you need to have no network situation or a situation where you are able to see any provider, even though you may be charged a higher cost. And now you can see it changes again. Now the premium under PPO. And this is the PPO from this particular carrier at this price point. A deductible, you can remember. No low deductibles here. Low deductibles for drugs, low deductible for health. Well, now you change some parameter, you change some aspect of the plan where you can go see an out-of-network provider. You don't need a referral here. You can go other places in the country. Let's say you're a snowbird, you live in Chicago. Gets cold. I know that. I went to business school in the south side of Chicago. And now you can see it. Annual drug deductible, $415. Very different than zero. You pay deductible, meaning, of course, you are the first one to the cash register. You're responsible for the first $415. And your total estimated cost now, much higher, $1,300 more. So in other words, what ends up happening is you end up having to make very, very complicated comparisons. We need to value how much it is worth in order to have access to out-of-network providers, out-of-network locations. This could be diagnostics, this could be x-ray clinics, this could be outpatient clinics, for example. And so now you can see the difficult choices here. You can continue, and on we go. Oops, sorry about that. So now we're scrolling down these plans, and you can see it here. We go to the next set of plans, and let's just view them all. So that just showed us the top 10 plans on estimated total cost, and what we sorted on was the estimated total amount of drug and health cost, and that's over here. You can see you can sort it in different ways. Let's say, for example, you never go to the doctor. All you're doing is going to refill. Okay, so now we're seeing all 30 plans. Now you can see what ends up happening. Let's just scroll down to the bottom. Let's scroll down to the bottom. What do we get? You can see this number. Dramatically increasing. Dramatic. Why? All the drugs aren't on the formulary. Big differences if you have to pay for the entire set. And now you can see right here. Let me see if we hit the brakes. All right. So you can see it here. $2,000 is your total estimated drug cost. As soon as all the drugs are not on the formulary, you can see the dramatic increase in estimated drug costs. Okay, so there's your you can see how sensitive it is. You can see how sensitive it is. Now, to make things more complicated, and it does get more complicated, let's go back up here, and this is vital. Vital. Remember why we chose the pharmacies? We chose CVS and Walgreens here. Let's remove one of the pharmacies. Let's remove one of the two pharmacies and switch it out for another. Okay, so we removed that one. Let's replace it with another. Let's widen our range here. So now we have a lot more pharmacies. Right, we have 3 pages of pharmacies. Now, and let's just use this one. Okay, so this is still well known in the Chicagoland area after have lived there. And now let's just go again to plan results. So we're going to again compare Medicare Advantage prescription drug plans known as MAPD. And now let's go. So now, again, 480 odd, 420 odd. You can see. Notice. What do you notice? You notice the names of the plans. As soon as you get to beyond number 2, it's changed. The planned, the sort order here has changed. We don't have the same plans on top. Not at all. And so now what ends up happening, you can see it here, that as soon as you change one element, one pharmacy in this case, if you change your doctor in or out, you can see what ends up happening. Your out-of-pocket maximums, for example, you can see all Medicare Advantage plans, they have an out-of-pocket maximum. You can see this plan lower than this, so that if you have if you need to go and have health services, hospitalization, skilled nursing facility, doctor's visit, office visit, diagnostics, durable medical equipment, this one has a lower maximum than this one by $1,000. The flip side is this one has higher anticipated prescription costs by $300. This one is almost certainty, right? Because you need to take those medications. Maybe you don't use the inhaler that many times. Here you can see it. What I'm looking at here is, okay, let's say you have a bad health year. What happens here? Now, the reality is we could blackline all of the names of all of these carriers and these plans. None of that really matters. It's just an illustration, meaning if you live in Florida, you'll have a different list. If you live in Texas, you'll have a different list. Arizona, yet another list. The sort order, the order that these are displayed to you will be different. For example, let's go to the lowest health plan deductible. Why is this important? Those of you who live on a fixed income, where Social Security is your only source of income, you don't want to have a high health plan deductible in the beginning of the year, right? Because you're trying to plan for a stable income flow, which comes from Social Security every month. You can see it. And again, the plan order is different. It's different. Yet, nevertheless, you can see here, this one, not all the drugs exist. So you have a much higher prescription drug plan cost. So you can see how complicated and sensitive this website actually is. You might think to yourself, oh, well, I'm just going to go to this website and I'm going to put in my medications, I'm going to put in my zip code, and I'm going to play around with these sorts a bit and then figure out what's going to happen. Not really. Right? Not really. So you need to be careful. You need to run it a few different times. This is that situation. Some people aren't good at computers. Some people aren't comfortable. Some people are overwhelmed. And even once you get to this point, right, this is just a guideline. This is a guideline for how to compare plans. From there, you've got to go into the plan to find out something specific. Are the networks? How do referrals work? Is your primary care physician inside the network in this particular instance? What are the parameters? What are the rules of going to see other doctors? Is it an open network? Can you see a specialist without a referral? For example, some people don't like to have referrals. Some people don't go to primary care physician. They go straight to their cardiologist, for example. Let's take a look at some more. How important is the out-of-pocket maximum to you? You can see it here. Immediately, things look similar. But reality is that they're different in important ways. Some of these plans will have additional benefits. Some of these plans will calculate the way that they process the out-of-pocket expenses. There are particular plans whose network are nationwide, who are truly nationwide. One network, not a regional PPO, not a local PPO, but a national PPO, for example. So there are a lot of subtle differences here, and I know it can seem overwhelming, but these are some of the guidelines that I use when I take my persons through Medicare, comparing Medicare Advantage. On the podcast, the most recent video, you saw basically the way that I look at the Part D plans. Let's just take a quick look here, and then we're going to end the video. Okay? So let's just go to refine results. So you can remember the prescription drug cost here, $500, $1,400, $1,500. Okay? Now what we're going to do is I'm just going to give you a quick look, at what happens when instead of looking at Medicare Advantage plans, we're looking at standalone prescription plans. So here are the 27 plans. What do you notice? Premiums. And you notice higher numbers. Higher numbers here and substantially higher numbers. You can remember $500 was the top Medicare Advantage prescription drug plan with the HMO. And then from there $1,400. Well, you can see here higher right from the get-go. Let's just see if it matters if we have mail order. can see it doesn't matter. Mail order hasn't helped. Now I'm going to show you something that's going to be somewhat surprising. Let's just use these just for kicks. And we can hit compare plans. Here's the thing about prescriptions. Drug costs and coverage. These are numbers here. You can see this under this plan, the coverage gap is going to be reached. Why? Because of the higher deductible of this plan. You can see once you hit it, though, you get a lower number here compared to here. So these do change the pattern of cash flows even when the total costs look similar. I'm going to show you something more. So now what you see here is this looks similar between these. Okay? They look similar, but you can see that mail order down here is quite a bit lower than going to the retailer up here. Do you see it? $300 a year, $30 a month. Now what I'm going to do is the following, and I'll show you how dramatic some of this can be. This actually is less volatile than I would have expected. Let's just go to plan results, and we'll only just check out one plan. And let's just check out this first plan here. So we're going to go to this plan. Hello. We're going to go to this plan. There we go. All right. Nevertheless, this is still, now, this premium looks optically high, right? It is higher than the national average, which is going to be somewhere in the $32 range, $32.50, I want to say. I don't have the figure right off the top of my head. So certainly higher, but still what you're focused on here is this. That said, you'll see something very, very sensitive here. Is you'll see that inside the coverage gap, let's just take a look, 143 for Humalog, which is, right, this is the insulin, injectable insulin. So you can see what ends up happening. Inside the deductible level, this is only $6. And at CVS, it's $11. So you can see what ends up happening. At different points in time now, let's say you want to have everything, and now you have dramatically different numbers. Inside the coverage gap, 409. Inside once, which is the donut hole. Inside the donut hole, 143. Not easy. Okay, so what ends up happening is we end up looking at this overall total, and this looks similar. But when you actually see what ends up happening inside the full year cost, once you get into the coverage gap, much better here at one of the retailers, as opposed to getting it delivered via mail order from this particular plan for this particular medication. We're going to stop it right there. I'm sure that people's heads are spinning. This tells you that simply going onto the website and just trying to experiment and play around. These tools are good for guideline purposes. However, you need to be able to understand what you're looking for, because you can see that the financial differences here, the cash flow differences, are enormous. I'm Jay. This is the Maximize Your Medicare podcast. You're watching the YouTube channel. Please subscribe. Please go to MaximizeYourMedicare.com. You'll be able to see other videos. You'll be able to listen to podcasts. There's a free podcast. YouTube, iTunes, Google Play, MaximizeYourMedicare.com, everywhere you can find them. Thanks.